just go as long as it goes.
Great. Excellent. Okay. Thank you. All right. I think we're live again in here. Perfect. Thank you for persevering, everyone. And thank you, staff, for helping us. Hello again. This is the House Progressive Caucus. It is Tuesday, March 14th, 2023. We had a little bit of a technology glitch, but we're back in action and we are just going to restart our meeting. We are going to do just a brief amount of logistical updates for each other and then turn the floor over to a policy discussion around aging Vermonters and end of life issues with our guest we have today, who I'll introduce in a moment. So just in terms of, I'm trying to remember what we even talked about before, just briefly, everyone knows this, but just for those watching at home, just to repeat what we said before, we're beginning crossover season, which means that we will have a lot of time in committee to move bills out of our policy committees over the next week. We expect longer floors probably next week and the week after that. So if folks can plan around that, that would be great. The other thing, I know somebody else had an update, right? But I just wanted to give a brief update that for Burlington purposes, the just cause eviction charter change issue will be introduced soon. I'm waiting to see if I can get all the Burlington state reps on that piece. And so that one is moving quickly. And I will put in the other 4 items that were newly approved by voters on Tuesday, just double checking with the delegation that no one else has done that. And those are quickly ranked choice voting for the mayor, all non-citizen voting, which is all resident voting basically. And then 2 issues related to our ward and district boundaries for citywide election purposes and polling locations. Super exciting topic, that one. Anyway, so that is just, I think, briefly what I had said. Who else had the update?
Very quickly, tomorrow or Thursday, there will be a press conference at noon on the sex work decrim bill, and I would encourage all of my co-sponsors to attend. I will be speaking as well as Senator Becca White.
Great. Thank you, Representative Small. Okay. Anything else? Did anyone think of anything else? Great. My studious people on their laptops. Okay. So we have Meg Polite from the Vermont Alzheimer's Association with us today to help us to dive a little bit into policy areas for consideration around aging Vermonters and issues that arise with that. And so welcome so much, Meg. And usually what we do is we have our guests speak for a few minutes on policy issues, in particular things that we should be paying attention to this session. And then we have a little Q&A afterward with our members. Thanks so much for being here.
Super. Thank you for having me. And I'm sorry that Ruby couldn't make it and also that I'm not there with you in person, but I'm looking out the window and wondering if I'll even make it the 5 miles home. So we're getting a good snowstorm here. So my name is Meg Polite. I'm the policy director for the Vermont chapter of the Advocacy Association. And I asked to talk to you in the beginning because I wanted to sort of share what's going on with bills that we're working on from the position of Vermonters with dementia, and particularly their unpaid family caregivers and the strain that they're facing and how that sort of plays out across the spectrum of our communities and our families and our budget. And originally Ruby Baker was going to join me from the community of Vermont elders, and she can't make it. So I'm also going to talk a little bit about sort of a bigger picture of pieces that we play into, and fully encourage Representative Small to help me out if I stumble here a little bit, as I know this has been in her committee a lot, and that's where I watch over a lot of this work. So just big picture. There's more than 13,000 Vermonters over the age of 65 with Alzheimer's or another dementia. That's a number that's increasing by over 30% and will be 17,000 in the next year and a half or so. And for each person that has Alzheimer's or dementia, there's generally 1 to 3 unpaid family caregivers who are supporting them. And the care for these people is a little bit different than caring for people with other chronic diseases or temporary diseases, in that it is 24 hours a day. It is cognitive as well as physical, and it can go on for 1 or even 2 decades with increasing intensity. So it's a little bit of a unique group of caregivers, and the types of services and supports that they need in order to remain healthy themselves and active, particularly in the workforce for us, are pretty broad. So we just received our 2023 statistics, and they really leaned in this year to the health impacts on caregivers. So coming out today, in Vermont, 61.5% of caregivers of caring for people with dementia report chronic health conditions. 35.4% of caregivers for people with dementia have reported depression, and 10.7 self-report that they're in poor physical health. And these numbers in Vermont are actually higher than all of our neighboring states, but even higher than the national average. And that's just to give you a picture of why it's so important to kind of build these services and supports out. So just from the Alzheimer's perspective, what we have been advocating for is a state dementia coordinator. So somebody that would be positioned within the Agency of Human Services, because this is a disease that is a health disease and involves risk reduction on the part of the person with the disease, which happens through the Department of Health. And then all of the services and supports for that person after they've been diagnosed, or for their caregivers in caring for them, come through programs run through the Department of Aging, Disabilities, Aging, and Independent Living. We've been advocating for the position to be shared between those departments and reside in the Agency of Human Services, but we'd be open to any way that it was placed. We did work with Legislative Counsel, who said that $150,000 a year would be the appropriate level for a position with this type of responsibility. And we've done a lot of work with partner states who already have this position to understand what makes it really impactful and does what we're hoping, which is to increase efficiency within our state and to open up some opportunities for us for additional funding. I will say there's 23 other states in the District of Columbia, so 24 places that have this position written into their general funds. And there's 16 states, including Vermont, that are working this legislative session to put it in place. Right now, it has been placed into the budget through the memo that came from the Committee of Human Services, where Rep. Small sits. They were just talking about it in the Appropriations Committee this morning, and we're hoping that it's going to get put into the budget and move forward on the Senate side. So I guess I'd like to talk a little bit about what's going on in the rest of the crisis that wraps around this, and then open it up to questions just to kind of keep it a little broader. So as I mentioned, there's a lot of stress, particularly on these unpaid family caregivers. And so a lot of the services that we use are what are considered home and community-based services through the state of Vermont. And in 2005, the state initiated what we call the Choices for Care program, or our long-term Medicaid program, to really open the possibility for anyone who is 18 or older. In my case, I'm looking at people with dementia who are older than that, to be able to be cared for in the location that they choose and through less costly measures than what was traditionally done, which is you would go into some kind of institutionalized care, whether it was a home for if you had a disability, or nursing home if you were older. And we as a state knew that that would save us money. And so there's a lot of programs that are wrapped into and receive reimbursement through Choices for Care. And they have been beyond critically underfunded for a long time. And the impact of that is that some of them have closed. Some of them have reduced their ability to serve because, for instance, there may be beds available in long-term care facilities, but there's not staff to cover the beds because we can't pay staff enough to attract them there. So last year, there were some rate studies requested by the legislature to really try and dig into some of these key pieces and make reports back. And those studies really showed that what we already knew on the ground, that they are critically underfunded. So they recommended anywhere from 30 to almost 80% increases to make these organizations whole. So that if you are, for instance, the Visiting Nurses Association, and you're traveling 6 million miles, I believe is what they said, over the year they travel to provide services, you can afford to reimburse people for the increased mileage rate, which is required, and you can afford to pay them for what they're doing. And I think, you know, the big overarching picture of this that hits everywhere from unpaid family caregivers to the people providing this care is it's primarily women's work, and it's primarily undervalued work in the same way that we see in the childcare sector. So we are advocating, along with many coalition members, for the increase to long-term care, enhanced residential care rates of 4%, for the implementations from the rate studies for all residential and assisted living care facilities, and for the increases for personal care, homemaker, and respite companionship services. And were put in the memo from the agency, from the Committee on Human Services. And part of these, like the piece for respite, companionship, and personal homemakers is 15% this year. We know we need to go a lot farther. This is part of a multi-year plan because we couldn't go the full rate. So this is already over $2 million, and we needed, I think, about 30 million to really make it whole. And the one piece where I think we're still lacking and where it really touches my demographic the most impactfully is the adult day program. So these are programs where people can bring their loved one with dementia or other issues, but in my case with dementia, where they can stay for the day, where there's a nurse on site, where they're having appropriate social interactions and being cared for. There is an increase of 15% in the budget right now, but those programs have been very clear that without a reimbursement rate of $25 an hour, they're not going to be able to stay open. We've seen more than, I think 4 have now closed since the beginning of the pandemic. Several are operating under capacity, and they're in a very unique situation in that when there's a snowstorm like today, if somebody doesn't show up, they don't get paid. So it's not like a situation where you might pay $300 a week for childcare, and if your child goes or doesn't go, you pay $300 a week. The adult day program only reimburses for when the person is there. And obviously, if they don't show up, you're still paying your staff, you're still paying your building. So that program in particular is one that I hear so much back from advocates who said we could only remain in the workforce because we could put mom in an adult day and go to work, or dad in an adult day and go to work. So I would urge you, if it's at all possible, to advocate for that rate to go up to $25 an hour for those programs. I think they are vitally, vitally important. So I'm going to just stop there. There's a million things I could say, but I know you only have about 10 minutes, and I'd really love to try and address whatever is top of mind for you all around these, and also bring questions back to our coalitions to answer if I can't answer them myself.
Thank you, Meg. Questions from the caucus? A riveting group. Well, I have one question, Meg. So obviously we're on the cusp of perhaps passing paid family leave. And I know one of the components I'm glad to see in this bill, at least as it's drafted right now, hasn't come to the floor yet, is to really be expansive and thinking about paid family leave. And I've seen this in other conversations as well. Or at least I've been trying to push this conversation around. Dependent care is much larger than just children under 18, et cetera. So I'm just curious, what conversations you've been having around paid family leave. Does it feel like that what's in that bill hits the mark for helping? I know this is more like on the family side of it and not the actual formal providers, but just threading that needle. It's a piece of the puzzle, really. So I'm just curious if you all have looked at that bill and have any thoughts on how that connects to your work.
100%. We've looked at the bill. We're very active in that coalition. And actually at the paid family medical leave press conference, we had one of our advocates with younger onset Alzheimer's who was speaking to it and was really saying, like, this is not a care program for me. But she's pretty typical in that her husband and her daughter, her 2 primary caregivers, both work full time. And she feels like a huge burden already, and it doesn't ask them to take off to come to doctor's appointments for her, and really spoke to how just having this would allow her to bring one of them to a doctor's appointment and be able to actually follow through with the care, because she goes home and she has no recollection of the meeting, and she looks at the notes and they're written in doctor's lingo, and it doesn't help her at all. So we absolutely advocate for that. There were pieces of the bill that we worked with Representative Kornheiser on to make sure they were strong, that we support in there, including that you can take it, you don't have to take it all in one chunk. So you could take off a Friday to do all your medical appointments or to go visit long-term care facilities to see where you're going to move your loved one or family member to. I think it's extraordinarily important. And I know that as a coalition, when we talk about this workforce again, this undervalued workforce that often has children, that it could be something that would make it possible for more people to feel comfortable becoming a direct care provider, where right now they feel like, I wouldn't be able to, because what if daycare closed, or what if my kid got sick? I have no option to not go to work without losing my job, and I'm not comfortable. So We absolutely believe in that. I think it's also important to just say that as of 2021, 17% of Vermont's workforce was over 60 years of age. So this is vitally important to all of those people that are working as well and may need to take off for their own health or their spouse's health as they age, and there are more health related issues that you're trying to navigate.
Mm-hmm. Thanks, Meg.
Yep.
I assume that was the case, but just checking. And I guess I'll throw in another one. Really to bring back to the coalition, because I think it's actually going to be a study. So a bill that I initiated, H92, is actually the spirit of it is being pulled into H55. It's technically an unemployment bill, but I raise it because it sort of picks up a gap where paid family leave leaves off. And so the idea would be, again, just specifically to H92, would the state expand its eligibility for unemployment for urgent and compelling reasons. And it's not an exhaustive list, but it's a starting list that includes things like unexpected loss of childcare or caring for a sick or ill family member, which requires you to quit your job because either you've exhausted all your sick leave or whatever, but it throws people into economic insecurity, obviously, when that happens. And so if Vermont, H55 will study it, I'm hoping the Senate will fix it and actually just do it. But anyway, that's my mission for another day. But I just flagged that because I think this also applies here around this ability to support people economically when they are supporting family members, who are transitioning into different elements of care, aging and whatnot. And so this would apply for folks when they're ready to come back into the workforce, be able to access unemployment after they've handled their family crisis, their ill family member, whatever the transition points are that force them to leave the workforce and trigger what this urgent and compelling provision would be. So I just flagged that because I think it's another piece that I'm sure that folks that you are advocating for get impacted by if they have working younger folks.
So true. And please do circle, like I could, what comes to mind immediately is the family member who's caring for mom, dad, or whoever, and they either pass away or they move them, it becomes impossible and they move them into long-term care. Yeah. And then they can go back into the workforce. And I've heard of just the challenges. You're dealing with grief. You've been out for 2 or 3 years. You don't really know where to start. And I think, having that scaffolding to get back there and that that value of, you're starting to earn something while you're figuring out how you get back in. I think it could be huge. And I would love to I will look it up, but I think if you get to a stage where you need testimony or if they're doing the research, to be sure to advocate for inclusion of people who have been caregivers for adults who have passed or have had dementia would be a really important piece to include in that. So
great. I'll definitely find that. It's going to be coming to the floor soon in the House. But again, when it gets to the Senate, maybe we can add that element to it, especially into the study part of it, so we get a complete picture of what we really ideally can build for when this becomes real policy and not just a study. Yeah.
Super. And I did just want to say before you end, we will be having our Alzheimer's Awareness Day at the State House on April 6th. So you'll see us on the House floor. We'll have our joint resolution. We'll be getting recognized on the House floor and be providing the devotional that day, and along with some other activities, which I'll be sharing with y'all as they get updated. But I'd love it if you could put a little holder on April 6th. I know there's youth coming to the day also to the State House also for something, but there's space for all of us. And I know they'd be happy if you wore purple, and I'd be happy about that too. So. But just you will see us there on April 6th. There'll be a large group of people. And if there are other bills that you think are important that you want us to be talking about that day, I'll try and stay in touch with the caucus and keep watching for in case something like this is moving and it makes sense to try and say some words in Senate Health and Welfare or wherever it may be.
That sounds good. Thanks, Meg. Well, I wore purple today because I forgot it was Equal Pay Day. So I'm just on the wrong day. Maybe I'll wear red, unfortunately, on April 6th, but I'll try to get it right. Great. Well, thank you so much, Meg. We really appreciate you joining us today and sharing all the important work that your folks are doing. And any final words from Caucus?
Always grateful for your advocacy, Meg. I don't have much to say because I get to hear about all of these pieces in the work in the House Human Services Committee, but your advocacy has been invaluable up until this point.
Yeah.
So,
Thank you so much. And thank you. I know it's just so heavy what all of you hear and do all the time. So the appreciation is very, very mutual as I watch you from afar and wonder how you can balance all of this need with the resources and also with the push down in how we care for each other. So I really appreciate you thinking about older Vermonters and starting to talk more about them. And I think that that's a big piece of bringing the conversation in. So enjoy the snowstorm, stay safe, and thank you so much.
Thanks, Meg. Take care.
Bye-bye.
Thank you, Meg. Bye. Okay, we are ready. Thank you all for attending.